Welcome to the Alternative Treatment of Glaucoma webinar. This is your host, Dr. Edward Kondrot, and I want to thank you for joining me on this very important webinar to help you improve your vision. I'd like to share with you some of the alternative treatments that I have found to be beneficial in the treatment of glaucoma. I'm really happy that many of the treatments that I'm performing in my practice and teaching patients have received national recognition. The Kondrot program to restore vision has been featured on national TV, numerous public news stations, CNN, CBS, Fox News, and Martin Sheen did a special on our center in a production called In Focus.
The eye has been called the window to the soul. Now, some in the medical community are discovering it may be a window into health and nutrition as well. Eye disease is one of the most common causes of permanent disability in the United States. More than 20 million Americans age 40 and older have cataracts, and 10 million Americans age 60 and older have age-related macular degeneration, or AMD. These eye diseases occur as we grow older, and proper nutrition may have some effect on both of them.
In my 35 years of practicing ophthalmology, I am convinced that eye disease is caused by three important items: poor nutrition, the accumulation of toxins in the body, and stress.
Several green leafy vegetables such as spinach and kale contain the most antioxidants, which protect your eyes by reducing damage related to oxidizing agents that can cause age-related eye diseases. However, the vast majority of the American diet is extremely harmful to our eyes, and experts caution against eating foods that over time can cause serious eye conditions.
The traditional American diet, consisting of genetically modified food, preservatives, and high fructose corn syrup, is destroying our health and vision.
Dr. Edward Kondrot is the world's leading homeopathic ophthalmologist who devotes his practice to traditional and alternative therapies for the treatment of eye disease. His prestigious Center for Healing the Eye, located in Dade City, Florida, just outside Tampa, promotes wellness of sight, body, mind, and spirit.
My belief is that the body can heal itself, and my goal is to restore lost vision. We use therapies like microcurrent stimulation, syntonic light therapy, oxidative treatments, homeopathy. All of these are non-surgical treatments that not only help treat the underlying cause of disease, but they also act as a catalyst to help the body heal itself and restore vision.
The center treats patients who seek holistic, non-invasive therapies for eye problems that include macular degeneration, glaucoma, cataracts, eye strain, and other eye disorders. Dr. Kondrot has a worldwide following because of these successful therapies. Well-known author and psychologist Dr. Basha Kaplan came to Dr. Kondrot for treatment of glaucoma.
For 10 years, I had taken glaucoma drops. I was diagnosed with glaucoma. I had emergency cataract surgery in both eyes, and then I developed epiretinal membrane, where within 1 month my vision went from 20/30 to 20/50, and I didn't know what to do. I was just freaked out, and Dr. Kondrot gave me back my life after I went to his clinic.
When we went to Dr. Kondrot, he did established a whole protocol of treatments for her, which was both microcurrent machines and light therapies. And since that time, Basha's eyesight has improved tremendously, and she has a whole new life now because of it.
About 10 years ago, I was diagnosed with macular degeneration. The subsequent diagnoses that I had all confirmed that it was either wet or dry, but that there was no hope. My research brought me to Dr. Kondrot's clinic, and from that, it also brought me hope that there was something we could do. And he stressed not only different therapies, which have been important, I think, in my treatment, but also the nutritional value of to condition the body to withstand this disease.
At the Healing the Eye and Wellness Center, we emphasize an all-organic diet consisting of fruits and vegetables. In fact, at the center, we grow our own vegetables in a strict organic environment.
Dr. Kondrot is the pioneer in the field. Dr. Kondrot developed the protocol that is now being implemented here. He's had remarkable success. It's incredible. As a matter of fact, when I first heard about it, I didn't know whether I even believed it or not, but I certainly do now.
At the Healing the Eye and Wellness Center, we carefully evaluate every patient for nutritional deficiencies and toxic metals. Most patients need a nutritional IV to help restore their nutritional state.
Dr. Kondrot's extensive research has taken him around the world and places him in a unique position to share this knowledge through his two best-selling books, Healing the Eye the Natural Way and Microcurrent Stimulation, Miracle Eye Cure. Both books are solid introductions into his philosophy and practice. His latest book, The 10 Essentials to Save Your Sight, has received rave reviews.
My mission is to bring hope to the thousands of patients who are losing their eyesight. Don't despair if you have been told nothing can be done to improve your vision. Change your diet. Begin to remove toxins from your body. Explore these alternative therapies that can act as a catalyst to improve your health and vision. It is my goal to improve your health and clarity of vision.
Healing the Eye and Wellness Center in Dade City, Florida has a fully functioning organic ranch with a garden, chickens, goats, cows, donkeys, and pigs. The grounds include a basketball court, swimming pool, hot tub, weight room, and infrared sauna, along with many miles of sandy road for jogging. If you like bass fishing, the ranch borders Lake Moody, one of the top bass lakes in Florida. The center houses accommodations for both you and your family during your stay. To learn more about Dr. Kondrot and the Healing the Eye Center, visit healingtheeye.com.
Who am I? I'm the only eye doctor to be board certified in ophthalmology and homeopathy. I'm the author of 3 best-selling books. I'm the host of Healthy Vision Talk Radio, and you are welcome to join me on the radio show every Sunday evening. And you can also listen and ask questions by tuning in online. I have a medical license in 4 states, Arizona, California, Pennsylvania, and Florida. And I'm also president of the Arizona Homeopathic and Integrative Medical Association, a wonderful organization of integrative and alternative doctors that are sharing with patients unbelievable care and helping them learn about these alternative treatments. I'm also the clinical director of the American Medical College of Homeopathy, a college that has homeopathic classes and a clinic. If you're interested in learning more about homeopathy, I would highly recommend contacting the American Medical College of Homeopathy. I practiced traditional ophthalmology for about 20 years, and then I suffered a severe case of asthma. Traditional medicine was not able to help me. Many of the medications that I was taking for my asthma developed severe side effects. That homeopathy cured me of my asthma, actually cured my asthma, and this was considered to be a condition that was uncurable. So since then, I've been integrating alternative therapies in my practice since 1990. So have you been told nothing can be done to improve your vision? You must take eye drops. If you don't have surgery, you'll go blind. Well, I think it's important that you learn alternative treatments to help. Doctors, I think, are getting into prevention the wrong way. What do I mean by that? Well, many times a patient has an elevated pressure and they're started on eye drops to prevent glaucoma, although they really don't have glaucoma. So very commonly, I see patients who are taking eye drops for prevention, but they don't have glaucoma. This group, I feel very strongly, should embrace these alternative therapies, begin strengthening your body and improving your health, and that will improve your eyesight. The bottom line is the diagnosis of glaucoma is difficult in most situations. most eye doctors just base the diagnosis on eye pressure, but it's much more than that, and I'll talk a little bit more in detail later. I have to caution you that glaucoma is a very serious disease. It can lead to blindness, unlike macular degeneration, which rarely leads to blindness. So if you are going to utilize some of these alternative treatments that I'm discussing, I have to caution you, make certain that you still have close contact with your eye doctor, that your pressures are monitored, your visual fields are monitored. What I'm telling you is not to be a substitute for traditional care, and I have to emphasize that. Typically, when I see a patient with glaucoma, I do not stop their medications. I begin these alternative treatments, and then after careful monitoring, if their pressures are lower and their eye appears to be healthy, then we can taper their eye drops. But do not stop your eye drops, and do not substitute these alternative treatments that I'm going to talk to you about for your eye drops. Glaucoma is a serious disease, and you need to have this condition carefully monitored by your eye doctor. The incidence of glaucoma is growing. Primary open-angle glaucoma has increased 13.8%. Glaucoma suspects have increased 6.5%, and narrow-angle glaucoma is increasing by 2.7%. And I think this is a factor of our environment. The food that we eat, the toxins are in our environment, and the stress, all these things are contributing to the increased incidence of glaucoma. As I mentioned, pressure is just the tip of the iceberg. Glaucoma is a very complex disease, and we have to look at the 7/8 of the iceberg, which is below the ocean. This is where I think that the majority of the treatments should emphasize. It should emphasize the 7/8 component of glaucoma that I think is responsible for visual loss. It is not just the pressure. So we need to look at the emotional state. I'm convinced that emotions are tied into our eye conditions, and we need to evaluate them and treat them. Certainly, I feel that glaucoma is a disease of the autonomic nervous system, that we need to look at balancing the emotional centers, and we'll find the treatments are much more responsive. Circulation is a big issue. We need to look at methods for improving circulation to the optic nerve. I believe that glaucoma is a disease of circulation of the optic nerve, a neuropathy of the nerve. Also, nutrition is critical. The body will not heal without the right nutritional components, and we have to look at detoxification. If you do have toxic material in your body, like heavy metals, they have to be removed. The most common symptom of glaucoma is none. That's why they call it the thief in the night. It can slowly steal your vision without you being aware of it. So if you do have a family history of glaucoma, it is important that you have your pressures checked periodically. If you do have symptoms like halos at night, blurred vision, headaches, a loss of side vision or peripheral vision, you need to be evaluated by an eye doctor and have your pressure checked. Now, the diagnosis of glaucoma, it's more than elevated pressure, because there is a condition called low tension glaucoma, where the pressures can be normal or even low, and you can still have glaucomatous loss. In fact, you can have a low pressure and still go blind from glaucoma. Typically, the diagnosis of glaucoma is made by characteristic visual field changes, loss in the peripheral vision, and also changes in the optic nerve. Here we see a cross-section of the eye. And in glaucoma, the pressure increases in the eye. And because of this increase in pressure, it causes stress and damage to the weakest part of the eye. The analogy is when you put too much air into a basketball. The basketball is going to expand, and it's going to have damage by the weakest part, which is the seam. In the eyeball, the seam is where the optic nerve enters the back of the eye. So as the pressure increases, it's pushing on this optic nerve, causing damage to the neurons and a decrease in circulation. So the two approaches of treating glaucoma are to lower the pressure to relieve this damage to the nerve. And also we need to look at methods to improve the health of the optic nerve, to improve the circulation. This is a visual field analyzer commonly used to evaluate and diagnose glaucoma, and it's also a very valuable tool to evaluate the success of treatment. Traditional eye doctors will state that once you have visual field damage, it cannot be reversed. And I have found this to be false. With proper treatment, improving the health of the optic nerve, improving the circulation of the optic nerve, I have seen reversal of visual field damage. This is an example of visual field damage. The dark areas are loss of vision, and it's in a characteristic pattern, typically being in the inferior aspects or the superior aspects of the visual field. This is what the optic nerve looks like. On the left is an eye with glaucomatous damage. You can see the white area in the central area is expanded and larger compared to the right. This is the left compared to the right. This is evidence of glaucoma where you have enlargement of this area. It's called cupping of glaucoma. In the progression, this cup will expand on the left eye until it actually encroaches on the edge. In the eye, we have nerve fibers. These are tiny fibers that run from each rod and cone in the eye, and we have over 100 million in the eye, and they run from the cone or the rod to the optic nerve. We have hundreds of million of these fibers, and we can measure the thickness right near the optic nerve as they go into the nerve and then go to the brain. And this is called the nerve fiber layer thickness. This is a very accurate way of measuring the health of the eye, diagnosing and measuring the evaluation and success of treatment. We have sophisticated instruments to actually measure the thickness, and this is a good way to evaluate the health of the eye and measure the success of treatment or progression of glaucoma. It's called the nerve fiber layer. The current treatment of glaucoma is crazy because glaucoma is more than pressure. It is about the health of the optic nerve and the health of the person. The analogy is like treating high blood pressure by destroying blood production. And that's essentially what we do in many cases of glaucoma treatment. We're destroying the aqueous production, the fluid production of the eye, to lower the pressure. Much like if someone has high blood pressure, destroying the blood production to lower the pressure. So I think there has to be a better way, and that way is to look at the health of the optic nerve. Every day I hear from patients who are having a lot of problems with their eye drops. The eye drops are toxic, and patients are developing severe allergies and redness. So I'm not telling you to abandon and stop your eye drops, but you do need to look at other methods of treating your eye for glaucoma. Laser surgery is a short-lived procedure. These laser procedures will help for a short period of time, maybe 3 to 6 months, but they have to be repeated, but they don't treat the underlying cause. Often surgery is needed for glaucoma. This is the last resort when the pressure is extremely high, but typically after surgery, there is still progressive visual field loss.
My name is Angela Bruno. I'm a college professor from New York. I had Graves' disease and a thyroid condition. I met Dr. Kondrot when I flew to Naples, Florida for my first 3-day treatment. Prior to that, I had spoken to him in August, a year and a half ago, and he had prescribed a homeopathic remedy. I explained everything to him, what my illness was, what my debilities were, and he advised that I should see him. So as I said, in September, I flew to Naples, Florida for a 3-day treatment. I was blind in the left eye, partially blind in the right eye, and I flew alone on a plane, stayed in a hotel alone just to see him. The 3-day program was very, very good. I left feeling hopeful, feeling positive. I came back to New York, and what can I say? It is very disheartening, it's very scary, it's frightening when you have been independent for 20 some odd years. You've done everything alone, and where you had to try to see your nails, you couldn't see your nails. I would go to the kitchen sink to make coffee in the morning, and I was unable to pour the coffee into a cup without over spilling it, or I had to put my thumb in a cup. Even things like walking down the stairs, I had to kick the back of the step to know that, and to feel and to slide the foot down for me to be able to walk downstairs. This was just unbelievable. After 3 months, I flew again to Arizona and did another program over there with more equipment, more machinery. 3 months later, I then flew again to Naples, each time progressing more and more and more. My eyes started to recede back into the head. They were bulging and distorted before. I had an eye that was wide open and disfigured. The eye started to shrink. My vision started to come back. So with that third trip to Naples, Florida, another 3 months passed, and I flew to Dade City, where his wellness center is, which is absolutely beautiful. And I stayed here for a few days, did another round of treatment. My eyes progressed so well that I am so proud to say that I drove with my mom in the car from Deerfield Beach, Florida to Dade City, which is about a 4-hour trip. I was unable to drive for over 7 months. My vision now is beautiful. I can see the clarity, the sharpness. I can actually see a split nail. I can see when they gave me a manicure and it's off a bit. It is absolutely wonderful. This is my 4th time with Dr. Kondrot, which we call Dr. K. He will be in my life forever. He is a brilliant doctor. He saved my eyesight, gave me my quality of life back, and I will be forever grateful. And I will be a patient of his until the day I die. And I thank him from the bottom of my heart.
I was at a recent meeting at Baskin-Palmer Eye Institute on glaucoma, and one of the professors there who had glaucoma got up and chastised the group of ophthalmologists. He said, "The treatments for glaucoma do not work." He said, "I have glaucoma, and I've taken my eye drops faithfully. I've had my surgery, and I'm still losing vision." And the conclusion at the meeting was that eye drops and surgery do not work. Yes, they can slow the progression, but they don't treat the underlying problem. And the conclusion at this glaucoma meeting is we need to look at other areas to help improve the health of the eye. And I'd like to start by talking about diet. We talk about our 70-30 diet, that 70% of your diet should be organic, raw, and living food. This is essential. I believe that food is our best medicine, and we are what we eat. So why organic? Well, there was a study done in the 40s that looked at the nutritional content at various foods. And let's just take spinach as an example. In the 40s, the average serving of spinach had 158 milligrams. Recently, that study was repeated, and it showed that it went to 2.2 milligrams. So in the 40s, we had much greater nutritional value in our food compared to 2012, which the study showed 2.2. My goodness, it went from 158 milligrams of iron to 2.2. So much of our food is nutritionally deficient. There was a study done in Chicago that showed that organic food had a 5 to 10-fold more nutritional value and a 5 to 10-fold less toxic in terms of heavy metals. So there's 2 reasons to eat organic. One, you're getting more nutrition. Second, you're getting less toxins. So I don't like to hear patients tell me, "Dr. Kondrot, I can't afford to buy organic." I'm telling you, you can't afford not to buy organic. You have much greater nutritional value and less in the way of toxic metals, poisons, pesticides that are contributing to optic nerve damage. Why raw or living food? Well, heat destroys the delicate protein structure of our food. There's loss of amino acids and loss of digestive enzymes, and amino acids are the building blocks, and we need digestive enzymes to absorb the nutrition. This is a wonderful book called I Am Grateful that gives some fabulous organic recipes. So organic eating can be great. So remember, I'm talking about 70-30. 70% of your diet should be organic raw. The other 30 can be cooked. Genetically modified food. I could give an entire 1-hour lecture or a day lecture on this subject. For more information, read the book Seeds of Deception. For some reason in the United States, we're embracing genetically modified food. Genetically modified corn is banned in Mexico, and most European countries ban genetically modified food. There have been many studies show that genetically modified food is increasing our health risks, increasing our risks of neurological problems, cancer, growth problems, and I believe eye disease. So that's another reason to eat organic. We should avoid corn and high fructose corn syrup because the majority of corn in the United States, 90% is genetically modified, and all high fructose corn syrup is made from corn. 3 reasons to avoid high fructose corn syrup. 1, it's made from genetically modified corn. 2nd, the high fructose corn syrup is not a true sugar. It's not metabolized like glucose normally, like normal glucose. It's shunted more towards fat storage, and it puts more stress on the pancreas. That's why there's an increased incidence of obesity and diabetes in our country. Also, in the manufacturing of high fructose corn syrup, there accumulates mercury. Some alternative doctors feel that there is more mercury in high fructose corn syrup than tuna. There's an interesting syndrome that was proposed by Dr. Ben Lane, an optometrist, and he feels that if you have difficulty focusing at near and you don't have proper spectacles, you will get an increase in intraocular pressure. And he has studied this, and he feels strongly that if you're having strain while you're reading or working on a computer, you need to reduce that strain by getting the correct pair of reading glasses. It's called the fatigue syndrome. Associated with this fatigue syndrome is chromium. Chromium is necessary for the metabolic activity of the ciliary body in your eye, and this is responsible for focusing. It was found that glaucoma patients have a decrease in chromium. Normal healthy patients had a value of 279. Open-angle glaucoma had 119, about half the value. So I feel it's important that all glaucoma patients have their chromium levels tested. There's a simple taste test for chromium. You squirt a solution in your mouth and you just report the taste, and this is fairly accurate to see if you are deficient in chromium. Also, if you are taking a glaucoma vitamin, make sure that it has chromium in it. Because nutritional deficiency is so rampant, and the majority of patients that I see are nutritionally deficient, I recommend they have a Myers cocktail. This is an intravenous vitamin formula that is composed of vitamin C, B-complex vitamins, trace minerals like chromium, and the B-complex vitamins are excellent for the optic nerve, and the vitamin C is a powerful antioxidant, and it helps lower the intraocular pressure. So I recommend that you receive this Myers cocktail once a month, and that's part of my program, getting this intravenous Myers cocktail once a month. And if you want more information on this, contact your local alternative doctor. Hydration is important. There was a book written, Your Body's Many Cries for Water, by Dr. Mangeldi. He felt that many chronic diseases are due to dehydration. Why is hydration necessary? Well, hydration is essential for detoxifying the body. Also, When you have a lot of fluid in your body, your blood is thin, and there's more efficiency with circulation. Every cellular activity, every enzymatic activity in our body needs water. We need water. So I encourage you to drink at least half your body weight in ounces of water. Keep yourself well hydrated. The problem is, where do we find a good source of water? We know there's dangers of public water. Pharmaceuticals are not found in water. They also know there's dangers of plastic bottles. It was felt at one time that it was safe to drink water out of plastic bottles. Now reports are coming out that phthalates and benzene derivatives are found in the water, which can be extremely toxic to the body. I'm a big advocate of reverse osmosis. This is a method of purifying the water. Investigate this. Get a reverse osmosis machine, put underneath your kitchen sink, and use this for all your drinking water. Get the lead out. More and more studies are coming out that show that lead is a contributing factor to eye disease. There was a national study that was published out of Harvard University that clearly correlated elevated lead with cataracts. And I feel that it's a contributing factor in macular degeneration, and elevated lead can be toxic and cause further damage in folks that have glaucoma. Testing for heavy metals. The best way to do this is to have a 6-hour urine for heavy metals. This is a challenge test. You take a chelating agent like EDTA or Captamir, and then collect your urine for 6 hours and send a small sample to the lab for evaluation. Do not just do a spot urine test or just a straight blood test. It'll probably be normal. You could be dying of lead poisoning and your urine and blood will be normal. And this is a printout here of a patient who has elevated lead. We need to get rid of the lead to improve your health and improve the function of your optic nerve. Chelation therapy is the best way to remove the lead and also improve circulation. There was a national study done called the TAX study in the United States, the trial to assess chelation therapy, and this conclusively showed that chelation therapy will improve circulation and reduce the incidence of heart disease. We have intravenous chelation using a substance called EDTA, ethylene diamine tetraacetic acid. There's also rectal suppositories. There is topical cream and oral. Typically, I recommend patients have the intravenous, but if there's a problem finding a doctor doing the intravenous, the next best option is rectal suppositories and oral. My lead is moderately elevated, and I'm on a program now of rectal suppository chelation and oral. I think everybody should be taking oral chelation simply because our environment is so toxic. The air we breathe, the water we drink has trace levels of lead. It's in our food. It's, I think, the major problem that's related to our poor health. Another big part of my practice is homeopathy. And I have a question for you. Who was the first homeopath? And most people will say Samuel Hahnemann. Well, it actually goes back before Hahnemann. It was Moses. In the Bible, Exodus 23:20, he took the calf, which they had made, and burnt it in the fire, and ground it into powder, and stewed it upon the water, and made the children of Israel drink it. Well, this is how we make our homeopathic remedies. We burn it, we grind it into powder, put it in water, and drink it. Now, what is really interesting, gold is a homeopathic remedy, and the calf was made from gold. And gold is a homeopathic remedy used to treat depression and despair. So Moses was right on with his homeopathic prescription. How does homeopathy differ than traditional medicine? Well, homeopathy has a respect and for the wisdom of the body. This is called the law of similars. In homeopathy, we believe that the body is intelligent. So when you develop a symptom or a disease, it is necessary for the body to have that in order for the body to maintain homeostasis. So, for example, if you develop diarrhea, your body needs the diarrhea, maybe because you had some toxic food or you have a virus or flu. The body needs to excrete certain material to maintain homeostasis. Now, traditional medicine treats with opposites. They believe the body doesn't have an intelligence. So if you have diarrhea, they give you something which causes constipation. The homeopathic doctor will actually give you a substance which causes diarrhea. Now, that may seem kind of strange, and you may be saying, I don't think I like that type of treatment, but it works. If you believe the body has a wisdom, then homeopathy helps your body do what it's trying to do. For example, when I was cured of asthma, I took a homeopathic remedy that causes asthma. And we see this sometimes with allergy treatment. If you're allergic to ragweed, what does the allergist give you? He gives you dilutions of ragweed. And you may be saying, hey, doc, are you nuts? I'm allergic to that stuff. But this is based on the law of similars in homeopathy. So you see an onion on the left. When you peel an onion, your eyes water. So when somebody comes in with watery eyes, we give them homeopathic onion or allium sepia. A bumblebee on the top, when you get bit by a bumblebee, you get redness, burning, and swelling. Well, if your eye has redness, burning, and swelling, we give you homeopathic Apis mellifica. There's a rattlesnake at the bottom. When you get bit by a rattlesnake, you get hemorrhage and bleeding. And homeopathic rattlesnake or Crotalus hortus is a big remedy for treating hemorrhages. Also in homeopathy, we look at you as an individual. So we not only look at your eye problem, we look at other diseases and physical problems we have. The bottom line is that we treat the individual. We don't treat the disease. We treat you as a person. We also look at your mental and emotional state, because I feel strongly that many diseases stem from mental and emotional anxiety, especially eye problems. Another big aspect of treatment that is very successful for glaucoma is oxidative treatments. This is a therapy that uses a highly reactive form of oxygen to increase the oxygenation, stimulate oxygen uptake, and stimulate regeneration. We have ozone therapies, hydrogen peroxide, and ultraviolet light therapies. Dr. Silvia Mendez, a brilliant physician in Cuba, has treated thousands of patients using ozone therapy. And she's reported over 90% of patients have had a improvement of their glaucoma, improvement of visual field, vision, and acuity. I recently presented a paper at the World Congress on Ozone in Rome, Italy. 27 nations were there, 95 papers were presented. I presented a paper on my experience using ozone in the treatment of eye disease. It's a wonderful therapy to consider. It's safe, it's non-toxic, and one way of administering that is through rectal insufflation. So you don't need IV treatments. You can place a small amount of ozone gas rectally, and it can be absorbed into your body to dramatically improve your health and improve the state of your eye. This is an example of intravenous hydrogen peroxide, which is a type of IV ozone treatment. Hyperbaric oxygen. I have found that hyperbaric oxygen typically lowers pressures around 5 millimeters of mercury. Also, it helps increase oxygenation of the optic nerve. But you really don't need an oxygen chamber. Alternative doctors have reported that exercising with oxygen is reported just as effective as going into a hyperbaric chamber. So you would rent an oxygen tank, high flow oxygen, exercise vigorously for 15 to 20 minutes on a trampoline or an exercycle or a treadmill, and you can achieve the same beneficial effect. And it's kind of resetting the oxygen uptake in your body. So even if you do it once or twice a week, the effect still will last for 3 to 5 days. I was introduced to microcurrent via the famous golfer Sam Snead. I read an article about Sam Snead having a dramatic improvement of his macular degeneration when he underwent microcurrent treatment. and I began utilizing that in my practice. I had the pleasure of treating Sam Snead a year later, and this is a photo of me and his center, or his home in Florida. And below, Sam gave me some golf lessons. Everyone wants to know, what did Sam tell you about your golf game? Well, he took a look at me swinging, hit a bucket of balls, and then he put his arm around me and said, Dr. Kondrot, here's what I want you to do. I just want you to cut back for a year and then just give it up. So I took his advice. I no longer golf. I guess I'm too busy in my eye practice. But he was a wonderful man, and he was a big supporter of microcurrent and treatment of macular degeneration. This is a book I wrote. I really wanted to share this with other eye doctors, that microcurrent can be a miracle eye cure for macular degeneration. And let me explain why. This is a simple, non-invasive treatment that can wake up your optic nerve, lower your pressure, and improve your vision almost immediately. And this is, well, let me back up here. On the right is a patient getting microcurrent treatment. We wrap these gloves with a washcloth and place it over the eye. That's how we administer the microcurrent. It's a very easy, comfortable way of administering the treatment without probes or needles. We can also use microcurrent by placing the gloves wrapped in a washcloth on the abdomen. This is good for detoxification and also good for stress. These are some of the mechanisms of microcurrent: increase in circulation, increased cellular activity, reduces inflammation, reduces scar tissue, has a neuroprotective effect, and stimulates stem cell. Now, patients often ask me, are there evidence? Are there publications? It's just your observation, or are there articles in the literature? Well, I'm going to tell you that there have been many studies done on each one of these categories. There's no question that microcurrent has all of these effects. And it makes sense. If microcurrent can do all of these things, certainly it is going to help your eye. So let's look at improving cellular activity. This was a study that was published in the Clinical Orthopedic and Related Research Journal, a peer-reviewed journal. And Dr. Cheng looked at the effect of different levels of microcurrent on the cellular activity. And he observed and measured that between 50 and 500 microamps of microcurrent will cause an increase in mitochondrial and an increase to 300 to 500% in ATP levels. ATP is kind of like the gasoline of the cell. So we need ATP, that fuel, and when these levels increase, we know that we have more cellular activity. So this article conclusively showed that microcurrent stimulates cellular activity. And my goodness, this just wasn't 10 to 20% increase. This was 300 to 500%. So we're waking up dormant cells. We're waking up sluggish, non-functioning cells in your eye and your optic nerve. But I have to emphasize, you need to have the right nutrition. You need to have the right hydration, or microcurrent will not work as effectively. Microcurrent is widely used by athletes, treating injuries, reducing inflammation, breaking up scar tissue, and increasing the rate of healing of the body. On the left is a picture of Lance Armstrong, and his cycling team routinely hooked up their bodies to microcurrent after every race. They treated themselves head to toe to reduce inflammation and regeneration. Now, the two athletes on the right, it's my wife Lee and myself. This is after the Marine Corps Marathon, which I ran 2 years ago. I had no business running it. I'm 63 now, a little overweight, and I didn't train properly. And I was sore after this race, after this 26.2 mile race. And the only reason I run it was because my son was running his first marathon, and I wanted to show him that I could still do it. We were suffering. And after one 30-minute microcurrent treatment, it was amazing. All of my pain and discomfort went away When I was younger, in my 20s and 30s, it would take me 2 weeks or so with massage and hot soaks to get rid of all the pain. 30 minutes, the pain was gone after microcurrent. Microcurrent has a neuroprotective effect. This was an article that looked at the application of microcurrent in surgically induced glaucoma in rats. 3 groups. One group didn't have any microcurrent treatment. Second group had 2 hertz. The third group had 100 hertz. The conclusion was that application of electroacupuncture at 2 hertz provided neuroprotection by preserving retinal function in rats with experimental glaucoma. And the comment was, low frequency electroacupuncture may be an alternative therapy in the treatment of glaucoma. So, why hasn't mainstream medicine picked up on this? We have so many problems with our drops, complications with surgery. I'm not saying that microcurrent will replace surgery and replace eye drops, but I believe it should be a treatment that is considered in every individual that has glaucoma. Microcurrent can stimulate stem cells. We've been hearing a lot about stem cells, that this is the way to regenerate lost vision in glaucoma. Well, you don't need stem cell transplants. Microcurrent stimulates existing stem cells. Study out of China showed that direct microcurrent influences the adhesions characteristic of osteoblasts. Osteoblasts are primitive stem cells for bones. Many orthopedic surgeons use microcurrent to stimulate the healing of bone fractures. This was study looked at microcurrent affecting dermofibroblasts, and it showed that it increases a growth factor, which is an important regulator of cell-mediated inflammation and tissue regeneration. So microcurrent stimulates this growth factor, which reduces inflammation and helps with tissue regeneration. So I think this is one of the reasons why we're seeing microcurrent cause a regeneration of vision, an improvement of vision and improvement of visual fields in the treatment of glaucoma. These are some other microcurrent studies done. I published an article in the Tanza newsletter in 2002. There was a study done, microcurrent in the treatment of retinitis pigmentosa. The one article, microcurrent reduces intraocular pressure, and microcurrent has a neuroprotective effect. I'm really excited that I am involved with a microcurrent research project at the Department of Ophthalmology at the University of Rome. I'm working with a Professor Matteo Russo there, and we're looking at the effects of microcurrent on an animal model of macular degeneration. Professor Russo feels that microcurrent opens up ionic channels in the nucleus, and it helps the retina regenerate. So I think that this study is going to have great application for evidence on the mechanism of microcurrent in the treatment of macular degeneration and glaucoma. In my experience, I've treated over 705 cases with microcurrent. The average pressure reduction is about 5 millimeters of mercury. I'm seeing expansion of the visual field, about 20%. Improvement of acuity, 1.5 lines, and improvement of contrast. Now, this is not a permanent cure. Typically, microcurrent will cause this improvement, and it'll last 6 to 8 hours. That's why it's necessary for most patients to continue microcurrent treatment to have this effect. This is an example of microcurrent in the bottom of the Grand Canyon. There was a young lady who twisted her knee. I did a 15-minute microcurrent application on her knee, and she was able to hike out of the Grand Canyon. Dr. Robert Rowan was with me during this event. He was so impressed with microcurrent that he decided to devote one of his issues of Second Opinion to microcurrent. Can you believe that a 5-minute procedure on your neck can cure glaucoma? This is a device called a Vazia device or a biomodulator. And osteopathic doctors have discovered that a malalignment of the head on the atlas, which is the top bone of the spine, can cause an increase in intraocular pressure and other symptoms like TMJ or headaches. So there's a simple 5-minute procedure on the neck, both sides of the neck, called the bowling ball procedure. I have a YouTube video on this. If you search bowling ball syndrome glaucoma, you'll find this on YouTube. But in 5 minutes, we can lower your intraocular pressure. This is a photograph of my late mother. She passed away 2 years ago. I miss her dearly. She was one of my toughest glaucoma patients. She suffered from glaucoma. Her unmedicated pressures were 24 in both eyes. On Alphagan, which she hated to take, it lowered the pressures to 17 to 18. And her ophthalmologist, who wasn't me, I advised her to see a traditional ophthalmologist in Florida, wanted her pressures below 20. So she stopped her medications. Her pressure were 24. We did a 5-minute biomodulator microcurrent treatment on her neck. Her pressures were reduced to 13 in both eyes. Amazing. I made a believer out of my mother. But this was not a permanent cure. We had to treat it several times, but I was able to get her off of her Alphagan medications with this technique. The fifth element, what is that? Well, when the Soviet cosmonauts came back from space, they were severely debilitated and sick. They had all the necessary elements for good life: oxygen, water, nutrition, and ultraviolet light, but they were missing the fifth element. What is the fifth element? The fifth element is the Earth's electromagnetic energy. There's a book written called Earthing, and I would highly recommend that you pick up this book. It's a wonderful book that talks about just taking off your shoes and socks, walking barefoot on the earth, helps you be grounded to the earth, and this can improve many chronic diseases, including glaucoma. There are devices called pulse electromagnetic field devices, which are similar to microcurrent, where they generate a magnetic field which produces a magnetic charge, a microcurrent charge, that I have found to be equally effective in helping folks with macular degeneration and glaucoma. But the caution with these devices is you want to have a gentle device. Too much pulse electromagnetic field and too high of a current can cause a elevation of pressure. So if you are using microcurrent devices or pulse electromagnetic field devices, make sure you have your pressure checked by an eye doctor. Dance and exercise can lower intraocular pressure. Below is a professor of African dance I treated. He had elevated pressure. Pressures were uncontrolled on 3 medications. And we did an experiment. I said, "Professor, you teach African dance. Get out on the dance floor." Here he is with his wife. He danced for 20 minutes. His pressure went from being in the high 20s, low 30s, down to the low 20s. Amazing. So exercise, the trampoline or rebounder, is a great way to exercise every day and lower your pressure. And this just isn't my observation. This is an observation that has been published in numerous articles that show that exercise can lower intraocular pressure. It's a new treatment for glaucoma. What about Dr. Bates and his exercises? Well, when I was a resident, we made fun of Dr. Bates. We thought the guy was a nutcase. And Dr. Bates, I changed my opinion when I read the book called The Art of Seeing by Aldous Huxley. Huxley was a brilliant scientist. He wrote The Brave New World, Doors of Perception. And I found out that Huxley had poor vision most of his life. And in fact, during his life, he had to read using Braille. When he began to use Dr. Bates's methods, palming and sunning, he had a dramatic improvement of his vision. So both of these books is a good way to learn more about Dr. Bates and his eye exercises and his therapies. His one technique is called palming. Simply closing your eyes and putting the palm, your palm over your eye. And this is kind of like a way of doing microcurrent. Electrical energy comes from our hands, and by putting this electrical energy, directing this healing energy from our body into our eyes, is a way to help treat various eye conditions. Also, it's like meditation. You're deep breathing, you're relaxing, and Dr. Bates felt that all eye disease was caused by stress, and by reducing stress, we could help reverse eye problems. And I have seen patients do palming that have had a lowering of their intraocular pressure and improvement of their vision. Dr. Bates also talked about sunning. I thought this was extremely far-fetched. How can this possibly help? And he recommended that when the sun was on the horizon in the morning or the evening, close your eyes and let the image of the sun go across your retina. He felt that this would strengthen your eyes and treat various ocular problems. But Bates was right. There was an article published that showed that low-level laser therapy improves vision in patients with age-related macular degeneration. They used a 30-second application twice a day for 2 weeks. They evaluated the patients, and the majority of them had an improvement of their vision. Many had resolution of macular changes. Amazing study that was published out of Germany. So when I heard about this study, I purchased the laser they used. It's a Thor laser, and you can see the top left, a treatment directly on the eye. And we're also treating the neck. It's been shown to help detoxify the lymph, and laser treatment on the neck also helps improve arterial flow, blood flow to the eye. In addition, we're using this device to stimulate stem cells. We treat the long bones of the leg, the shin bone, and we also use it to treat the sternum. Studies have shown that laser light will stimulate stem cells. I have been searching for an inexpensive device, and I found one called the Delta Plus. It actually has 4 components. I talked earlier about the pulse electromagnetic field. While it does generate a very low magnetic field, which I feel is safe for the eye, it generates a red infrared light and syntonic light, and also an ultrasound. So you get 4 modalities in one. If you want more information on this device, go to the link down below, healingtheye.com/Delta laser. But I have to tell you a funny story. When I got the laser and I was treating my eye and my wife was treating her eyes, she made a comment. She said, "Honey, this is just like looking at the sun." And I said, Bates was right. You know, sunning is a way, because if you think about it, Bates taught to do sunning when the sun was low on the horizon. It has a reddish tinge, which is red, near infrared. So now we're discovering that these devices produce that same energy to help our ocular health. So you don't really need a laser. Do what Dr. Bates advised, sunning. Another interesting study that showed that low intensity laser radiation, the cold laser that I mentioned previously, can reduce the intraocular pressure. A 30-second treatment reduced the intraocular pressure by 50% in some patients and less in others. And it was discovered that patients with glaucoma had a greater pressure lowering response compared to those who did not. So, a really good study that shows that the cold laser can lower the intraocular pressure. But I have to caution all of you that are listening, if you do invest in a laser, make sure that your eye doctor checks your pressure, because this is all wonderful information that I hope many of you embrace these methods. But please have your eye pressure monitored to make sure, because in some situations, if you're doing it improperly, or you do it for too long of extended period of time, it can cause an increase in pressure. This is something interesting. Can you believe that a vitamin, a nutritional product, can reverse glaucoma damage? Oral citicoline. Study was done with 41 patients with a diagnosis of progressing glaucoma. they received acetylcholine for 2 years. At the end of the study, the group that received acetylcholine had a much slower rate of visual loss. All right, that sounds good, but how about the next one? A neuroprotective role. And acetylcholine treatment up to a period of 8 years led to the stabilization or improvement of glaucomatous visual field. Yes, they documented improvement of visual field. So here's a nutritional substance. So what's the connection with glaucoma? Well, it's been demonstrated that acetylcholine is reduced in glaucoma, and this substance might have a role in the treatment and prevention of glaucoma. Because of this excitement, I've developed a product that has not only acetylcholine, but other key ingredients to improve vision and memory. I call this my vision and memory formula. I also have developed a product called the optic nerve support, which I feel has all the essential ingredients to help maintain a healthy optic nerve. Vitamin C, B complex. There have been some studies that show that high doses of vitamin C can lower the intraocular pressure, and this would be a good way of treating just short term, but I don't feel that this is very practical to take extremely high doses of vitamin C for a long period of time. Vitamin C is essential as a to detoxify the body and improve your immune system. We have B complex vitamins, which are essential for the health of the optic nerve. Ginkgo biloba, which has been shown to improve circulation. Bilberry and grapeseed, 2 powerful antioxidants. And it has chromium, which I mentioned earlier. It's been found deficient in glaucoma patients. Coenzyme Q10, Coleus fuscoli, which is an Ayurvedic herb that has been shown to lower the intraocular pressure in some cases. We also have digestive enzymes, probiotics, and betaine. These are to help the vitamins be absorbed into your body, because one of the biggest problems as we get older, the vitamins and nutrition that we take are poorly absorbed. We need digestive enzymes, probiotics, and a little supplemental betaine or hydrochloric acid. I also recommend an ocular function spray. This is a blend of liquid vitamins and herbs to support the optic nerve. I like this because this is a liquid product that quickly absorbs through the tiny blood vessels in your mouth to the mucosa. And we also have a homeopathic glaucoma formula. These are not eye drops. This is a medication that goes under your tongue, and it's absorbed through your body to have a physiological effect to decrease the pressure, reduce swelling, and reduce the intraocular pressure. And this is based on homeopathic principles. So can you believe we can improve your vision in 3 days? Well, 85% of patients who complete my program have a significant improvement of vision. And I have submitted the results of my program to the Journal of Alternative and Complementary Medicine. It has been approved for publication. They're making some revisions. This paper dealt with 152 patients with various eye problems, but just let's review the results with the glaucoma patients. Here we see 29 patients, 58 eyes. The average change in acuity, improvement of acuity after 3 days, was 6 letters. That's 1 line on the eye chart. The average change in contrast was 3.6 letters, and contrast is your ability to see lighter and lighter letters. The average drop in pressure, 4.8 millimeters of mercury, which correlates to my earlier observation of around 5 millimeters of mercury. Of course, there was a range of improvement. 10 patients, 10 eyes had 2 lines or greater, and 6 eyes had no change. But looking at the data, some people underwent this program had perfect vision. So, it seems like the better your vision, the less improvement you had. Contrast, the range of contrast improvement. Visual field expansion, 37 eyes. The majority of eyes had marked visual field expansion, which is really amazing and exciting, especially when eye doctors state nothing can be done to improve your visual field. Greater than 5 millimeters of mercury were in 13 eyes. The majority had 1 to 5 milliliters of mercury, and there was no change in 11 eyes. But many of these eyes that had no change, I asked them to stop their glaucoma medication simply because I felt the patients that I treated in the study did not have glaucoma. They just had an elevation of their pressure. And this is a scattergram here of the results over the 3-day period, showing the different degrees of improvement over the 3-day period. Here's an example of marked improvement of visual field changes. On the left was before the 3-day program. You can see the dark area on the top is a hemianopic field defect. After 3 days, a complete return of normal vision. Unbelievable, and this return has continued. So I think in many cases there's a dysfunction of the optic nerve, a dysfunction of circulation, maybe a structural problem, and if we correct that, we can have an immediate and dramatic improvement of vision.
I'm Dr. Carol Benoit, neurologist, and I have just seen Dr. Edward Kondrot for the first time for devastating eye problems that have really put me under for the last month, especially. Rapidly worsening eye inflammation and tearing. My basic problem is glaucoma due to autoimmune eye disease called uveitis. And in the hands of 4 conventional ophthalmologists, of course, nothing gets better. I just add eye drops, which I'm rabidly allergic to at this point, and eye visits and costs. And he has significantly reduced the size of a blind spot in my left eye. I am just so thrilled about that. He's improved my visual acuity significantly, 3 lines on the eye chart. My contrast sensitivity is markedly improved. And my comfort level is markedly improved. Every treatment seems to bring greater improvement for me. I've been most impressed with the reduction in my allergic symptoms with the cold laser, but everything helps. I love the microcurrent machine. It gets me more relaxed than anything that I have gone through. But basically to see the improvement that I have just learned about today after this, my 3rd day of treatment, is astonishing, with hope for further improvement in the future. God bless him. Thank God for bringing me here. Thank you.
So we have our traditional Kondrot program that we have at the Florida Wellness Center. We call it our boot camp, where you come here for a week, 3 days of intensive treatment, and the program continues for 1 year. I'm happy to relate that now programs can be done through a doctor trained in the Kondrot program, and we have about 20 doctors trained all over the country. You can get a list of those doctors on my website, healingtheeye.com. We also now have workshops. We call it Get Started with Microcurrent Workshop. This is just a 2-day workshop where we teach you how to do microcurrent and the delta laser. We're now starting to incorporate the delta laser in this workshop. So this is a simple way of having a 2-day workshop to learn more about microcurrent to help your eye problem. So you can call the office for more information, 800-430-9328, or visit our website, healingtheeye.com. That's all one word, healingtheeye.com. So the next step for you is to decide what program is best for you. I really hope that all of you will look at microcurrent, delta laser, cold laser, begin to change your lifestyle, look at your diet, increase your hydration, reduce stress, and get tested for heavy metals. I hope that all of you will begin my vitamin protocol. If you want more information, we have an intro to Dr. Kondrot's program on the following URL, healingtheeye.com/webinar.html, or you can always call the office at 800-430-9328, or email us at info@healingtheeye. You can also get a consultation with me to find out what therapies are best for you, and the consultation includes a 6-hour urine test for heavy metals, You don't have to come to the office for this. This can be done over the telephone or Skype, but I will need a recent copy of your eye evaluation, so I'm able to give you the most accurate advice based on your ocular and health status. You can join me every Sunday evening on Healthy Vision Talk Radio. That's 5 to 6 p.m. Arizona time on KFNX 1100 AM, or you can listen online no matter where you are in the world, www.1100kfnx.com. Of course, you have to kind of translate to different time zones. Right now, we're broadcasting 8 a.m. Eastern Daylight Time. You can call in toll free. Your questions are always welcome. Copy of my 3 best-selling books. You can order these by calling the office, Amazon.com, or ordering online. Now we have a special webinar special because I would really like all of you to get started in improving your vision. And this is my glaucoma protocol, optic nerve support, which has chromium, the ocular function spray, homeopathic glaucoma tissue salts, and the total for this is $159.90. But we have some bonuses. I'm going to give you a copy of my book, The 10 Essentials to Save Your Sight, and I'm going to give you a chromium taste test so you can measure your chromium levels to see where you are. And these gifts are worth $54.90. And we have an extra bonus worth $49.95. I talked about the acetylcholine. Well, we're going to give you a bottle of the Vision and Memory formula, which contains 100 milligrams of acetylcholine per capsule, and this bonus is worth $49.95. So I hope you take advantage of this special offer. It's my goal to help you with your vision problem, and I think the first step is to get started on the glaucoma protocol, and you'll receive all these bonuses worth $104, over $104. So call now, 800-430-9328, or you can email us with questions, info@healingtheeye.com, or you can go directly to this URL to get this information, www.healingtheeye.com/web-glaucoma. So I want to thank all of you for participating in this webinar. Unfortunately, because of the large number of attendees, I cannot take any questions. Please call the office or email us if you have additional questions. And I want to thank you again. And this is your host, Dr. Edward Kondrot, wishing you good health and clear vision.